I'll be quite open and honest in the fact that we've not particularly been able to get on our journey very well. And I hate putting excuses in the way, but we have had sickness, we have had, then that leads into more annual leave, etc. So when we have got together, it's been productive. But then we, like Alison said, I think she summed it up. We're all fired up, and then it seems to sort of flow away. So I sort of said, so the journey begins. And it's like the journey of when do you get on the journey? When is it the best time? When is it not the best time? And the QI brings all those. We've had we're getting ready for a peer review. There's always something else, isn't there, that you can do on a what I call as a do another day pile. But from our point of view, we're governed obviously. Every year you've got to submit your MPDA audit, the best practice tariff, and all of a sudden it comes round so quickly, and then you're going, right, who's had annual bloods, who hasn't? So we run a report, and there it is, staring us in the face. The usual sort of the usual suspects of chasing for annual bloods. Why did they not just come for their annual bloods? How are we going to do it? So I'm new in service, just over 12 months. So I was looking at what could we do for the QI to try and make those annual bloods flow a little bit. And I used to do what I'd call a one-stop shop. So they'd come for the annual bloods, they would come to the outpatients appointment, and they would also come for their annual bloods as well. So we don't do that at St Helens. We have a really good phlebotomy service, a children's one. They book in, etc. We go up. There's everything that you need to have your annual bloods taken. They work from 7 in the morning. It would seem so simple to be able to access this, but that isn't working. So what we were looking at is how can we achieve all our annual bloods, and so we looked at how we would be able to facilitate this one-stop shop. As we started talking, it would transpire that we have the Twinkle database, but we can't pull those bloods across. We don't pay sort of the extra money, or whichever way, it was never put into the Twinkle amount. So there's somebody actually inputting those into the system, and obviously that then looks at driver error, doesn't it, and time and putting them in. So some of the children might have had their annual bloods, but they've been overlooked and it's not actually gone into the database. So we thought, well, while we're looking at the one-stop shop, can we look at obviously pulling that database across? So what we're looking at is, so the team, I'm trying to, I can't put my slides up and see you all at the same time, Matt, why is that? Why can I not see you and put my slides at the same time?
Yeah, for some reason it removes that and just does the whole, the whole screen. But we can kind of see you and the screen.
See whether you're saying, God, this is the worst thing ever.
No, we're not.
No, it's going fine.
So our team consists of Dr. Ijaz Ahmed, who's actually on the system at the moment. He's with us this morning, and he's our lead consultant for the Children's Diabetes Service. Dr. Pedastra Swath is our other consultant. She has less patients than Dr. Ahmed on the diabetes caseload. There's myself, the lead clinician for the Children's Diabetes Service. Jenny Brown's our lead dietitian, and we have just secured, we've had 2 new dietitians employed as well, so that's really positive, that's fantastic. Jenny's absolutely wonderful. She can never leave our service, so we'll just hunt her down and bring her back. And then we've got our beautiful PDSNs, Anne and Laura. Laura is a link, well, she's not the link nurse, but she works 15 hours a week on the ward as well. So she's our guru for clinical, etc., and she feeds back what's happening on the ward. So that's a really good inroad, especially to do with sort of high care and children who are in DKA and walking the staff through that as well. So we've got a really good, I've come into a really good established team that's got really good protocols, procedures. They're really, really, really hot on that, and the dietetic part of it is fantastic as well. But we're just missing this last little link, I felt, of how we're going to get the annual bloods without us all being under stress at the end of the year. You know, we are running around chasing these families. It takes a lot of work, basically. So the purpose was to facilitate a one-stop shop for the annual bloods whilst the children and young people attend their clinic appointment. Well, who are we going to focus on? Well, it's prevalent to everybody, isn't it? So we're going to focus it on all the children. but I think I've just picked up something before about perhaps we just pick it up on 3 or 4 children, but we can discuss that afterwards, can't we? The audit year, as you all know, runs from March to March. So that also brings in itself in the fact that if somebody's had their bloods done and they wait and they wait and they wait, and it's done right at the end of the year, they think they've had it done this year. Well, I've had it done. I had it done on the 31st of February. So I don't need it done again this year. So it's getting them, we was trying, I think, and obviously Ijaz will come here, I'm sure, at the end. We was trying to do it in the first quarter of the year, but it doesn't work. You are a slave to your families coming and having it done. And with COVID hitting as well, nobody wanted to enter the hospital for the first part of the year. And we're slowly sort of reassuring them on the second part of the year that it's safe to come in. So they're thinking, well, I've had them done this year. So you're having to explain, no, this year is this year. So that takes a little bit of time as well. And also we've got the people that don't attend. And I really liked what Alison said. We've got the nice DNAers that phone you on the day, or we've got an admin who phones up and it's oh, well, I'm working and this. There's those really nice excuses that are quite pliable why they can't come. So I really liked what Alison said in the fact that, you know, you get the ones that just really can't come, and you've got the ones that actually were never coming anywhere, but I've got this lovely pattern of plethora of excuses, as it were. So our improvement journey so far. Well, what are we trying to do? What are we trying to improve, and what frustrates the team? So just let me find my other side. Sorry, I've got my phone open as well, and etc. as well. So I'm just trying to juggle between the two. It frustrates us immensely that we know that there's annual bloods. We have a witch group on Facebook. We have a parent support group. We send out newsletters, and in every newsletter we put the number in to be able for them to access the blood people. We put it on the Facebook page. Every which way we can, we try and advertise the fact that the children, and more so that the parents and the children, need to come for annual bloods. It's part of their health needs. It's part of the family health needs. And I think when we were discussing it before, you were saying around about how do we talk to them? We need to change it. I think the parents own, if the child's been diagnosed quite early, the parents own this journey, don't they? And then all of a sudden they're asked to give it away. It's really frustrating. So we're working not only with the child, the adolescent, or the young person, but the family members as well. A child who's sort of 11 can't bring themselves for annual bloods. They're beholden to the family. And when we talk about talking differently, the NHS was always about you make me better, and now we're having to look at self-management. There's a contradiction in terms sometimes about how we're perceived as nurses or as clinicians to be able to facilitate that for families. What we're trying to achieve, well, again, I think Alison sort of summed it up. We're always trying to achieve that 100%, aren't we? That attainment, that 100%. And I think that, you know, looking at our improvement journey is we perhaps need to lower that. The measures, what have we tried and what have we tested? Well, we've tested doing it in the beginning of the year. We've tested doing it all in one go. We've tested phoning them up. We've tested sort of most things. So how will we move forward? And that's something that we're discussing. How can we achieve it? And we feel that the answer was that if we have somebody who can do bloods when they come, it will become in to see everybody. While you're waiting to see the dietitian, or you're waiting to see myself, or you're waiting to see the consultant, even if you need sort of Emily creams, but we have the obviously the squatty, you could squat it on the arm. I can't remember what it's called, in my mind's gone. But you could have those done. That would achieve that you're not having to come back. You wouldn't have to park up. So we thought it would be a really, really good idea. So a cross section of the caseload. To be fair, I've probably asked about 3 or 4 people. The positive part was that everyone said that would be a really good idea. They would be fine about having bloods. The people that I asked, which were probably the lead for obviously the Wish group, etc., and the deputy and 2 others, I did ask one of our parents who's got a little boy with educational needs, and she said that she would be happy for him to have it done on that day, as long as there was some distraction there as well, which they always provide, so that wouldn't be an issue. Who's joined us on our journey? Well, I've had to, HiCom is the people that obviously look at Twinkle. So I've been in talks with them around about how much it would cost to set up the system to pull those blood results across. The Path Lab obviously needs to be involved. I've had one conversation, if I'm open and honest with them. Obviously the children's blood team, and I've spoken to my higher management, and I think Dr. Ahmed has as well. And there were no barriers there. She's quite happy for there to be, you know, look at how we would facilitate that one-stop shop. So that's really positive. What have I done about it? I think not a lot at this moment in time. I think we've talked to talk. My thoughts would be looking at, when I've been looking through the literature, maybe the control chart from here, that we plot who's had their annual bloods done, who hasn't had the bloods done, what are the barriers for them not coming, and asking those questions maybe when we do our clinics. The other barriers are obviously sickness, time, tick tock, it's always there, isn't it? Annual leave because of the sickness. We've got lots of annual leave to take at the end of this month because of COVID as well. Redeployment, we've got that hanging over us that one of our staff may be redeployed. Cancelled clinics, DNAs, and obviously transferring the data straight to Twinkle. And I think that that's a governance. I think that's a risk, because there's a risk of somebody not typing that in right. So our most important piece of learning so far, and again, I think we're all singing from the sort of same hymn sheet. It's extremely hard to get all the team together. Really, really hard to get everybody together, okay? And that's not for want of everybody wanting to be together, all right? I don't want to say that nobody's negative. It's just doing it together. And there's also people within our team are quite happy to let other people do things as well. And that's the other thing as well. When we did get together, and obviously Ijaz may contradict this, but I thought we had a really great afternoon. It brought us together. I think we had some really good discussion. We laughed. We had biscuits and cake, and the consultants didn't lead that meeting. I felt that we all led it. We had an agenda, and I sort of set the room out, but I think we all pitched in, and I felt we was really positive when we left. I think we needed to explain more the control charts, what drives us, what actions we need to do. Our drivers are our parents. You know, they've got to be willing to do annual bloods, and it seems that every time we try to explain why, it doesn't motivate them enough to come back to us, you know, to actually get the bloods done. Sometimes the consultants are quite medically minded, and we need to look at the greater good of the families. How can they get here? I find that obviously, because I'm obviously new, the patch is quite lengthy in driving. So if you've got people that live, I'm going to say Newton Le Willows, Burnage, they're quite a distance. One of them's over the East Lancs Road. It's quite a distance away. If you don't drive, or you're relying on buses, etc., and it's a rainy day and you've planned to come and have your annual review bloods, is that the right way? So doing the one-stop shop, you've got to come to clinic anyway, obviously when they start back up again. So it would be seen more practical to be able to do that. I think we've got a clearer picture. We know what we want to do. We know how we're going to do it, but it's actually putting it into practice. And I think, you know, it's not just for the PDSNs to achieve, it's for everybody. And we're also always looking for that gold standard, aren't we? So that's where we're up to at the moment. A lot of talking, I think, but we do need to move that forward.